I'm Councilmember Priscilla Tyson, and I chair the Health and Human Service Committee. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. The subject of this afternoon's hearing is the 2022 budgets for Columbus Public Health and the Department of the Development Department's Human Services related funding. This is a hybrid hearing, so we will have some people joining virtually and some will be here in council chambers. On the agenda this afternoon, we have Health Commissioner Dr. Mashika Roberts and Anita Clark, the Assistant Health Commissioner, will speak about funding for Columbus Public Health. We also have Hannah Jones, Deputy Director of the Department of Development, will present on the human service funding. We also have special guest speakers, Charlita Tavares, CEO of Primary One, and Michael Corey, the Executive Director of the Human Services Chamber. The city's health and social service funding provides an opportunity to serve our most vulnerable residents. Our first speaker is Health Commissioner Dr. Mashika Roberts. Columbus Public Health protects, promotes, and monitors the health of the public by assuring compliance with public health laws, mandates, and regulations. Also establishing policy to address health issues and emerging health threats. And by providing preventative, environmental, community, clinical, and home-based services. In order to address the COVID-19 pandemic, Columbus Public Health has remained on the front lines, issuing and enforcing various public health orders, getting people tested, and continuing in the efforts to get the community members vaccinated. There will be continued expenses related to COVID in 2022. Further, public health is continuing to stay the course in addressing neighborhood violence, addiction issues, infant mortality, and funding affordable health care for our community. I know Dr. Roberts will cover the areas I mentioned and much more. With that, I would like to turn it over to Dr. Roberts to provide additional details on the Health Department's 2022 budget proposal. Dr. Roberts?
Well, thank you so much, Councilmember Tyson, and good afternoon, Chair Tyson and all members of Council and my other colleagues who are joining me this afternoon. Thank you so much for this opportunity to highlight Columbus Public Health's proposed 2022 budget of $39,476,663. As you have said so eloquently, Columbus Public Health has played a lead role in protecting the health and safety of our residents during the COVID-19 pandemic. While this year's budget is actually about 5% less than 2021's budget due to a reduction in COVID-19 operating funds, we continue to have American Rescue Plan dollars available to us for our COVID-19 response. As a result, the 2022 budget supports our continued response to COVID-19, as well as expanded programming for strategic priorities, critical needs, and health services for our residents that they so desperately want and need so that they can be healthy and safe in the new year and the years to follow. In light of some of the events that have happened in the last 24 hours, we continue to be involved and are very excited to be a part of the city's anti-violence work. Our budget includes over $4 million for Columbus Public Health's Neighborhood Social Services team, which is a critical part of this innovative effort to link residents to trauma support and needed resources. Together with Mayor Ginther and our city partners, our Neighborhood Social Services team is building a trauma-informed and resilient community through our work with the Columbus Care Coalition, Voices, Violence Intervention, the Dispatch 911 Alternative Response, and our neighborhood social workers. We are also honored to lead our city's efforts to address racism as a public health crisis. Our new Center for Public Health Innovation, which is really not that new anymore, has been hard at work at addressing some of the social determinants of health to achieve health equity in our community. Our current 2022 budget includes almost $2.5 million to support the work of the Center for Public Health Innovation, which is working on behalf of all of us to confront and address racism wherever and whenever we see it. And while we continue to lead the charge against COVID-19 and racism, we will continue to provide critical public health services that our residents need and depend on to live healthier and safer lives. Our primary care services contract, which is budgeted at $4.29 million to help address critical health issues such as diabetes and heart disease that disproportionately impact people of color in our community. And our proposed 2022 budget also allows continued provision of public health services that are mandated, as well as priority programs that the Board of Health deems minimally essential to meet Ohio public health standards. Public health services are needed now more than ever before, and we are grateful that this budget will allow us to achieve our highest calling, which is to protect the well-being and safety of the community and the residents we serve. The city's investment ensures quality public health care and protection are available to all residents during COVID-19 and the days that lie beyond. Columbus Public Health will continue to operate with a high level of efficiency as well as effectiveness to serve the health and safety needs of our entire community during these challenging times. As always, I appreciate your support, Councilmember Tyson, and partnership of Columbus City Council through this process and all year long as we continue our work on behalf of Columbus residents. I'd be happy to answer any questions you may have, and again, I thank you for this time.
Thank you, Dr. Roberts, for your presentation. And I just will ask maybe a couple questions. And the first one is, can you just kind of, I know you've gone into some detail, but a little greater detail about the neighborhood social services program and what role will the shift in FTEs from the Center of Public Health Innovation play in that regard?
I'm going to actually ask Anita if she can handle that. There's been a little bit of a shift from CPHI, but a lot of it are some new FTEs or carryover FTEs from 2021. But Anita, can you help with answer that question, please?
Sure, I'd be glad to. Thanks, everybody, and thank you, Councilmember Tyson. Center for Public Health Innovation, I'll start there first, has 22 FTEs, and you're very correct of what Dr. Roberts said. It's the carryover from our budget from 2021. And then as far as the neighborhood social services, we have 41 FTEs budgeted for 2022. And our goal really is to, as Dr. Roberts mentioned, to really work on our anti-violence and our right response, as well as all our trauma within the communities. That's our goal for 22. We have lots of different programming. We have some vacancies available that we will be filling in 22, and we're really looking forward to getting a lot of the projects started in 2022 as well. Any additional questions regarding our neighborhood social services programming? I'd be glad to answer those.
Thank you. No, Ms. Clark, and I'm very excited that we have this neighborhood social services program, and especially, as you said, just kind of the violence that is going on in our community and how important that this new program happens to be with the CARE Coalition, the Violence Prevention, the Violent Crime Review Group, the Community Right Response, and the Right Response Dispatch, and the neighborhood social work, which is focusing on the community trauma support and hospital-based violence intervention, the community-based reduction programs focusing on the geographical location and at high-risk individuals for violence, and that this team is also combined with the 911 calls and the 911 dispatch team. It's a critically important program. It's, when we think about reimagining public safety, that the neighborhood services program is integral to making sure that how we reimagine safety for our community. So I'm pleased with your answer, and I'm excited about the program. I also know that this budget will continue to address the issue of heroin and opioid as part of the Columbus and Franklin County addiction plan, with about $1.4 million in that program, and it will continue to fund about $300,000, be funded at $350,000, the Safe Point program that provides the Narcan and addiction counseling and treatment referrals, because as we know, through this pandemic, we certainly have seen an increase in individuals that have been definitely involved in substance abuse and addiction, illness, as well as overdoses. So these programs are so important. The last, I think, question I will ask, last question is, how does the creation of the Celebrate One as a department affect the ability to offer services to combat infant mortality? And I'm asking that question because I know that there's a role that Columbus Public Health plays in terms of infant mortality.
Oh, thanks for that question. And I think you are very much aware that Columbus Public Health was right there with then Council President Ginther when Celebrate One was first born and established. And we continue to partner with Celebrate One and work side by side with them. Now that Celebrate One becomes its own department, really does not change anything for us or for our services. If anything, it's definitely an advantage to Celebrate One and what they will be able to do. But we look forward to continuing our partnership and our teamwork with the new Department of Celebrate One as we move forward to try to reduce infant mortality as well as reduce the disparities we see in infant mortality.
Thank you, Dr. Roberts. And you also mentioned in this budget, we know that you're continuing to support the community neighborhood health centers in an amount of $4.3 million. And again, just appreciate that we want to make sure that everyone has access to health care and to address health concerns at multiple health facilities. And lastly, I just want to publicly just say thank you that I know the Center for Public Innovation is certainly focused on racism and also equity, and I am very pleased that that the Commission on Black Girls will be a part of the Columbus Public Health and Public Health Innovation, certainly led by Nicole Harper. So I'm very excited that that the work of the Commission will certainly be expanded with her leadership, as well as the work of the team of the public health innovation. So thank you. I don't have any other questions for you.
Thank you so much, and we're excited to have the Commission of Black Girls come to us as well. So thank you.
Thank you. I'm now going to ask Ms. Hannah Reed to certainly give us a presentation on the budget for the Department of Development as it relates to human services. Ms. Reed, the floor is yours.
Tyson. How are you doing today?
I'm fine, thank you.
Good. This afternoon, I will present the portion of our department budget that supports our social service agencies and the services they provide to Columbus residents. The overall Human Services Grant Program budget is proposed to remain at $5 million. $2,889,000 comes from our general fund, and an estimated $2,111,000 will come from the Emergency Human Services Fund. In 2021, we found ourselves in the midst of a pandemic that brought with it an increase in need for critical community services, while the city faced numerous impacts to its budget that had the potential to substantially decrease our ability to provide those services. As a result, instead of undertaking a new competitive process at that time, we provided an additional year of support to current grantees. As a result, we saw 57% of the clients served by HALT Violence maintain a stable income. 85% of the clients served by the Academy for Urban Scholars achieved a high school diploma, and 907 clients were able to access much-needed medical and health resources through the Breathing Association's mobile medical care and health clinic as just a few examples of success. Unfortunately, as this year comes to a close, we are still facing these same challenges. The recently released report from the Recovery and Resiliency Committee highlights the ongoing need to support our human service agencies in a long-term, sustainable way. In addition to the recommendations within the report, the city has received approximately $119 million in requests from the community for the resources that were made available through the American Rescue Plan. Rather than undertaking an independent competitive process for our allocation of $5 million, it is the goal of the department to work with the mayor's office to determine how this funding can support the implementation of the committee's work. Possible considerations include creating a larger competitive pool that utilizes these funds in addition to other sources, identifying requests that have already been submitted through the ARP portal, or possibly the continuation funding for another year for current grantees. The department anticipates identifying next steps in the coming weeks for action once council has reconvened in 2022 and the budget has been passed. While not directly related to the 2022 budget process, I do want to acknowledge the key role that our human service providers have played in assisting the city with the deployment of approximately $45 million in American Rescue Plan funding for the community's most pressing needs, which have included youth programming to engage our young people who lost so much during the first year of the pandemic and continue to be disproportionately impacted, child care initiatives so that parents could return to the workplace, small business support for companies that continue to struggle in an uneven and uncertain economy, and support for shelter providers as they face an increased need for services and staff. These organizations have served as a bridge to resources that our community has so desperately needed, and we appreciate the leadership of yourself as chair and city council to ensure that they continue to receive our support. I'm happy to answer any questions that you may have.
Thank you, Ms. Reed. And first of all, I do want to thank you and your colleagues in the Department of Development, as you just stated, to be able to work with the community to get one, that you certainly were able to provide significant dollars through the CARES Act. And then there's been some dollars that certainly have been spent with the ARPA funds. And so I just appreciate that work. I do know that this year would mark year 3 of the competitive human services grants program that started in 2019. And the grants were really focused on moving people from economic insecurity to economic security. And you stated some of the accomplishments just in your comments. The city's investment priorities include kind of income through employment, job quality, education and training, financial capability, stabilization, and resource supports. I know that you just mentioned kind of the 3 options. It would maybe that looking at the continuation of this grant, continuation of those same individuals who got funded. It may be that there be a competitive process based upon some of the criteria that possibly has come out of the Recovery and Resiliency program. And so I think you said the training, you said a third one too, right?
Yes, I said looking at some of the proposals that are already in the ARP portal. So the Department of Finance established an intake process for the community at large to submit requests for access to funding. And to date, we have $119 million already in requests, many of them from our human service providers and partners.
Thank you. And so that would be the third, as you just said, through the individuals that applied for the $119 million that said they needed those dollars to be able to continue to serve our residents during this time. Well, I would just say that we know that we are still in a pandemic, and that these social service agencies, so certainly through this pandemic, it has we know that prior to the pandemic, we were social service and human service agencies were requesting more dollars to support residents. What COVID has done is certainly put a spotlight on individuals who are already struggling to move forward and enhance their quality of life. And then we've added more people to the people that were already having the struggles. And so it is important that now we're hearing that the number, I mean, I used to sit here and say that we gave, we were having $5 million be in the community in regards to social service agencies. And there were times where we'd get, 20 million, dollars or 13 million worth of requests. And now we got $119 million worth of requests. And certainly we know we don't have that much in ARPA dollars, but we do need to, I think it just continues to show there's a significant need for for individuals in this community, at least about a third of our residents of our community, that are still needing some support to be able to try to live a better quality of life. And so I really do look forward to hearing. I will not be sitting in this chair at the time, but I do know that just the number that was ask for through these dollars, that there is a great need. And I'm just hopeful that, as you stated, that in the coming weeks, there will be a plan as to how we're going to utilize this $5 million. And then I look forward to the plan that will come out in terms of the federal dollars that we have. I know these are kind of one-time dollars and we want to use them properly. I also want to give a thank you to the Recovery and Resilience Committee. I know that their goal was not to look at dollars, but to be able to say, here are the needs in the community and how do we meet those needs. So I'm going to be looking forward to how we continue to support the human service organizations as we move, in the future, because the need is still great. So thank you for coming. I think you've shared, and in the coming weeks, you will be making some decisions and you will be letting the human service community know what that response is. I would now like to transition to our invited guest, and in order to provide quality services and programs to our residents, the city must work with community partners. And I want to first, because I know that this one partner will have to leave shortly, and I would like to have him to speak first, and then I'm going to go to our other partner. So I am going to ask from the human service sector, Mr. Michael Corey, the Executive Director of the Human Service Chamber of Franklin County, to please make some remarks.
Well, thank you, Councilmember Tyson, for the opportunity to speak with you and the committee today. I want to start by saying the information, the response you just provided is quite perfect, and I appreciate you saying what I might have just said, so you may not need me to speak right now. I also want to introduce you to Bhumika Patel, who is our brand new Director of Membership and Community Engagement. This is her first day, and what better way to start than to testify before the Health and Human Services Committee. And we will, of course, miss you very much, Councilmember Tyson, for your leadership and your support of the Health and Human Services sector, which you have just demonstrated again with your words. I will take a few moments here to just provide an overview of where the sector is at, and to reiterate our appreciation for the city's ongoing support for health and human services nonprofits, and of course to request humbly continued financial support and other support for the sector as we move into 2022. The first thing I'll say is that our folks have just been absolutely spectacular, and we're so proud of the 133 members that are part of our organization, part of our community. They employ over 15,000 people and serve hundreds of thousands in Franklin County, and they are tired. They are weary. And I know that all of us that have been fortunate to live through the last 20 months and work through the last 20 months, we're all tired to a certain extent, but these folks are exhausted. And the one unique challenge that I think is present for all the nonprofits that we have the privilege of serving is a workforce challenge. It's finding talent, it's retaining talent, it's developing talent amidst everything. And one of the things that I know the city continues to be focused on is how they can help address that for this sector, among others, because it's a challenge for all of the sectors I know. And we appreciate that support, that thoughtfulness, and the work that will come in helping to bolster that workforce. And the reason that's so important is that the needs in our community remain elevated from where they were prior to the pandemic. We've been trying to describe the pandemic as sort of a hurricane. And we thought in July we might have been on the edge of the storm, but we were, of course, just in the eye of the storm. And we don't know where we're going. We've heard some hopeful things about the new variant today, but we also know that there are some discouraging elements of that. And as ever, uncertainty of how much longer we're going to be in the pandemic stage of things. And all of that puts stress on our sector and our community more broadly. But the piece that I wanted to underscore is that the pandemic has elevated the needs across the board in the health and human services sector. And just like with the hurricane, there's a storm surge, but after the hurricane's over, the waters return to their shorelines. And we're not sure that the waters are going to return to their shorelines in terms of the needs in our community. So finding ways in which we can bolster the amount of funding and resources going into our social services providers to meet those sustained elevated needs, I think is both the challenge and the opportunity for our community heading into 2022 and 2023, including and especially with these one-time federal funds, but also changing the way we allocate resources for the sector, which, as you kindly noted, was a need before the pandemic, since those $5 million have been in place since about 1991. How do we get those higher? And we deeply, deeply appreciate that the city stuck to its commitment to funding those agencies through the hardest of times financially in the pandemic. But now we have the privilege of being able to plan a little bit going forward, and we're looking forward to partnering to find ways in which we can do that. But we appreciate the leadership of the city, of the development staff, certainly of City Council, and especially of the Recovery and Resiliency Committee and its chair, Christy Angel, who is soon to be our board chair at the Human Service Chamber. We're grateful for all of the work that is happening to help our city navigate the uncertainty of this ongoing crisis. And we look forward to continuing to meet the needs of this community going forward.
Thank you, Michael. And certainly, first of all, I want to welcome your new team member who will certainly, I'm sure, do a great job and continue to share all the great work that's going on in the Human Service Chamber and all the agencies that you support. I just really appreciate your comments, and I know that Ms. Reed, who is in council chambers, has certainly, I know, has a relationship with the Human Service Chamber, and as they are, deciding the best way to use these ARPA dollars and how do we think about this competitive process dollars, we'll be in conversations, I'm sure, with you, because as you just stated that, the sector has certainly during this process had to serve more individuals based upon the pandemic and now the effects of the pandemic, what is happening with the residents and our community. And so to really determine what are the best use of our dollars, one, the ongoing competitive dollars that we've had, what's the best use for those? But then to think about what are the needs of those ARPA dollars, because they're only, they're short-term dollars, but where can they make an impact as we continue to move forward? And lastly, the human service organizations, just like our corporate partners, everyone is really dealing with the shortage of the lack of individuals to work within our for-profits and nonprofits. And so we will have to continue to partner with you. And I really appreciate your leadership, Michael. We know we talk about this all the time, but your voice is definitely needed to be able to work with the city to help us to identify, again, what are the best uses of those dollars to help move our community forward. So I'm looking forward to the conversations that will continue between you and the Department of Development to share what you believe are the best uses of those dollars. And I also appreciate the work that you were able to provide and providing information and being a part of the Recovery and Resilience Committee. So congratulations on all the work that you're doing. We hear you. We hear you. We want to say thank you. Thank you to your sector for the work that have been doing and will continue to do to uplift individuals in our community. Thank you so much. I now would like to ask one of our longstanding partners with the City of Columbus is Primary One Health. And to speak on behalf of Primary One, we have the Chief Executive Officer and former State Senator Charlita Tavares.
Thank you very much, Councilwoman Tyson, and thank you for all of the work you've done on behalf of the residents of the City of Columbus and throughout the nation as a part of the National League of Cities. We really appreciate your leadership in the health, human services, workforce development, and certainly the Commission on Black Girls. Your leadership has has been noted not only here in our community, but throughout the nation in lifting up these issues. I also want to congratulate Nicole Harper on her new position, and she'll be, again, a partner with Primary One Health, but many in the social services sector. And then I want to thank Michael Corey and his new staff member for sharing the needs in the human services sector specifically. We are a proud member of the Human Services Chamber, and I share that because his membership helps to address the social determinants of health, which impact the overall health at 80%, at an 80% level, and our clinical care that Primary One Health provides 20% of the health of an individual, determining the outcomes of that individual's health. And so the work of the Human Services Chamber is critically important if we're going to improve the health status of individuals in Columbus, Ohio. With that, I will go through a short PowerPoint, and Nicole, if you could start us out with the PowerPoint, I'd greatly appreciate it.
Just give us a few minutes.
Okay.
We have, because things are a little different since we're hybrid, so we will.
While we're waiting, since my boss had such nice things to say about me, I guess you're not having to pay dues in 2022, Charlita.
No, I would have great things to say about you regardless. While that's being uploaded, I do want to just share a little bit about, for those that aren't familiar, and I'm always educating members of council because we have some new members of council who will be starting in January, and then we have relatively new members of council on the history of Primary One Health. Our mission and vision, our vision is very, very broad. We want to have high quality health care for everyone in our geographic area. We don't believe we do that by ourselves. We do that in partnership with other individuals. We also have a mission that focuses in on those within our community who are struggling, who have barriers, those who have barriers, social barriers, cultural barriers, or financial barriers to their health care. And so that's where we focus our time and energy, is to really address the needs of the underserved in our community. We have values. Our values are respect, quality, compassion, and service. And as was stated by Councilwoman Tyson, we have a long partnership with the City of Columbus, more than 48 years of being funded with the first community health center, the Billy Jones Brown Health Center back in 1973. And then from there, 7 additional health centers until we became one system of care in 1997 due to a financial crisis of one of those health centers. And the City of Columbus helped to create the Columbus Neighborhood Health Center, Inc. back in 1997, which brought all 7 of those health centers under one contract with the city rather than 7 independent contracts with the city. And in 1997, we became Columbus Neighborhood Health Center, Inc. And then in 2015, we changed our name to Primary One Health. We were always located in economically struggling communities of Columbus, Ohio, until 2014. Then we branched out and moved into the county, Dublin at that time, as well as went to another county, Pickaway County. But the focus has always been the City of Columbus. We are now 12 health centers strong. 11 of those health centers are now in the City of Columbus. and one is in the county of Pickaway, in Circleville specifically. You can move on from the next three slides. Next slide. Yes, there. So now we're in Columbus with 11 health center sites, and we're in Pickaway County with 1 health center site. And we also have 2 new mobile health centers that allows us to go in underserved areas in Franklin County, City of Columbus, Franklin County, as well as Pickaway County. Our services are comprehensive. We provide integrated behavioral health with our primary care, OBGYN, adult medicine, pediatrics, dental, vision, as well as many specialty services in partnership with the Ohio State University, Ohio Health, and others. We have partnerships with the City of Columbus and CPH specifically, with a shared dental director with Dr. Deskins, our women, infant, and children clinics that are co-located at Primary One Health sites in the City of Columbus. Our women's health program, which was transferred to us by CPH. We share our women's health medical director with Dr. Marable, and then we rent space from the City of Columbus at over $600,000 annually at those 4 locations that we've outlined. Next slide. These are just some of our expanded partnerships. A partial list, you'll see a list later on that shares some new partnerships with COVID-19 and our programs to increase vaccination and testing in our community. Next slide. Our footprint, next slide. These are just some of our facilities, our 12 locations and our 2 mobile health centers. As I shared, all of them are now in the City of Columbus, except the one in Circleville. Next slide. And these are additional sites. Next slide. Our stats. These are year-to-date stats for this year as of 10/30. Women's health, about 57,000 plus visits, etc. You can see that. And then in the top right-hand corner of the slide, as you're facing in, you'll see our COVID tests. We've done about 35,000 COVID tests, and about 32,000 of those were in Franklin County. That's wrong. The total of Franklin County is 32,000, but the City of Columbus specifically is 30,084. And then we've done around 14,000 vaccines in the city and the county. Next slide. Our payers, about 39% of our patients are served by Medicaid as their insurance. 38% of our patients are self-pay and or uninsured. Most of those self-pay patients qualify for a sliding fee scale, so they pay some, but not the full cost of their service because of their income level, but they don't have insurance. Some cannot get insurance because they're undocumented. Others choose not to get insurance, but they're low income. And then private insurance at 14%, Medicare, you saw the number there. These are our 2020 UDS stats. So these are confirmed by the federal government of our 2020 services. We won't have 2021 until about February of 2022. But these were the breakdowns in our COVID year. And it went down about 8,000 from the previous year. But we were still able to serve over 39,000 individuals. And about 62% of our patients are female, and you can see 38% male, about 29% Latinx, about 27% Caucasian, and then a large African population that is inclusive of our African and our Black American population. About 34% of our patient population speak a language other than English as their first language. And then you can see our LGBTQ at about 2%. That's growing because we're doing HIV PrEP services. And then our healthcare for the homeless, about 3% of our population. Next slide. This is an exciting program and one of the best programs that federally qualified health centers have, along with some hospitals, not all hospitals, but it provides the lowest price drugs for our patients so that they can save money to spend on those other needs that they have, whether it's rent, whether it's food for food insecurity, or whether it's buying clothes. But as of September of 2021, we've saved our patients over $11 million in real dollars. And as of September of 2021, we had over 9,000 of our patients participate in the pharmacy program. It's a continuous education. We have contracts with pharmacies throughout the geographic region of Franklin, Pickaway, Delaware, and other counties, where patients can go and get their prescription drugs at the 340B pharmacy discount price. We've got over 160 contracts with pharmacies so that it's convenient for the patients where they live. Next slide. Uncompensated care. We provide a lot of uncompensated care, and that's where a large percentage of the dollars that the City of Columbus has funded Primary One Health with goes. We provide roughly $7.9 million in sliding fee discount, uncompensated total care on average per year. And that's serving approximately 21,000 plus City of Columbus patients per year. Next slide. Next slide. These are the board and senior leadership's strategic goals for 2020 through 2022. We will go through another strategic planning process in about February of 2022 to see if these are still appropriate goals. Growth, strategic growth, where we need to be. We have mobile health centers, as I shared, because we want to go where there's unmet need. And that's why we went after funding to support with the ARPA and CARE dollars to support our mobile health centers. So we could go to those underserved areas in Columbus, Franklin County, so that we could meet the needs of residents. Testing, vaccines, and primary care. Strength, we want to make sure that we're as strong as we can be financially so that we can expand and serve more patients that their needs are being unmet. Choice, we want to be the provider of choice for not only partners in the community, but our patients in the community. And service, we want to ensure that we're providing high quality services to our patients. Next slide. These are just some of our top strategic priorities. Next slide. Women's health. Next slide. These are some, you can go back. Can you go to the testing slide? Next slide. Okay, and this is some of the work that we're doing to decrease infant mortality in our community. And I want to thank Dr. Roberts and her team for working with us on our HFA, our Healthy Families America certification, and ensuring that we got enrolled in the home visiting program. We're finding success with that program with the families that we have enrolled, and we're certainly going to increase that. You see some of the entering pregnancy program, we're increasing that, and we're going to birth outcomes as well as infants living past age 1. Next slide. Next slide. These are some of the partners, and I'm really excited about all the new partners. And again, thank Commissioner Roberts and her team for helping to expand some of these partnerships during the COVID testing and COVID vaccine period, which we're still in. They've identified some of the partners and provided opportunities for us to do pop-ups in Columbus, Ohio, and those partnerships have been very successful. And as I shared earlier, we've successfully provided testing to over 30,000 City of Columbus residents and vaccines to over 14,000. Next slide. And just about the program, the COVID program, continued coordination and management with our partners in the community, Columbus Public Health, Franklin County Public Health, State of Ohio, the federal government. Challenges with staff shortages. Michael Corey talked about staff shortages, MAs, medical assistants, and front desk staff, patient support specialists is what we call them. So that we can have those both face-to-face visits and telehealth. And then we're expanding our COVID testing. We're not only doing the nasal swabs, but rapid tests, clinical rapid tests at our sites, as well as home tests. And then we're increasing access to all the vaccines. We were doing Moderna and J&J, but then we started with our Pfizer vaccine so that we could also do children, so that whole families could come into Primary One Health and have their vaccines. And then improved access to PPE. And again, we want to thank the City of Columbus and Columbus Public Health because they've provided access to PPE as well as supplies as shared here with our federal, state, and local partners. Next slide. And here are just some pictures of our mobile health center. We're very proud of the diversity that we've included on our mobile health units that makes it family friendly, communities friendly to the residents of Columbus and Franklin County. Next slide. Here are just some other photos of our teams out in the community doing testing and vaccines. Next slide. Next slide. And any questions that you might have, we've really enjoyed our partnership. And certainly, Councilwoman Tyson, we've enjoyed our partnership with you. As the chair of the Health and Human Services and Workforce Development Committees, it has been a pleasure. And as Michael Corey said, we are sad to see you leave, but you need to enjoy what you're doing as well and take a little break. I know you're still working, but take a little break and do some traveling. I know you enjoy that as well.
Thank you, my dear friend. I thoroughly just enjoyed the presentation, and every time that you had the opportunity to share the great work of Primary One Health, it is, I'm always just, I learn so much each and every time, and I'm just appreciative of the relationship of your organization with the City of Columbus. As you shared, it is a 48-year relationship. It is an important relationship for the residents of our community. You stated in this presentation that you served 21,161 individuals that were either, that was uncompensated care, which amounted to about $7.9 million. It is imperative that, we know that one of the issues in terms of, we think about healthcare, is access to healthcare is a concern for our residents. And when they don't have access to healthcare, as you stated, this is also 20% of the thinking about the social determinants of health. And so if you don't have health care or don't believe you have access to health care, it's very difficult for you to have a better quality of life. And so sharing, you are a significant partner, and 21,000 of our residents have come to you. That did not have the ability to be able to pay the full cost or any cost for their health care. So we're very thankful that you are in our community. 11 sites within the City of Columbus, which makes it easy for our residents to be able to have access to your services. And I also recognize that there are places you continue to want to grow in. Besides your mobile units going to communities, but there are places in which you still see there is a need for growth where we don't have access to easy access to health care. And so I appreciate the work that you're continuing to do in that regard to ensure that that everyone has access to affordable health care for themselves. You also mentioned, and I appreciate that you stated that you've also cared for about 30,000 of our residents through this COVID pandemic, and you're still serving them. And also that the partnership with Columbus Public Health, and especially around the care for women in our community. You're serving about, I think it was 62% of your clientele happened to be, I think I was right, women, and that 36% of the clientele happened to be people of color or African or African American or African descent. I just know that when individuals have the opportunity to get services from you, as you said, you give them respect and compassion, whether they have the ability to pay, and that and I appreciate that. I appreciate all the partners you work with in our community to provide other services besides the health services, but the other services and partnerships that you're able to provide to help them to increase their quality of life. I also want to thank you for the 403B program that have saved our residents so much money so that they can use those dollars to support their ongoing quality of life in our community. You are a major
Councilwoman Tyson, on that point, the 340B pharmacy discount program not only provides direct savings to our patients, that $11.1 million so far this year, as of, I think it was October or September, but it also provides resources for Primary One Health. That's how we pay for the rest of the uncompensated care that the City of Columbus does not provide any funding for. It helps us with that and funding underwater services like dental. Dental does not pay for itself. The amount that we generate from self-pay, from our HRSA grant, none of that pays the full weight of dental. And so we're able to use our pharmacy discount funds that are generated to Primary One Health to support dental, because we believe dental is so critically important. Not every FQHC provides dental services in their health center sites because it is one that is underwater. And we believe that the one stop is a better model for us, for our patients, that we have the dental there, we have the vision there, and so we can serve the whole patient and the whole family.
That's absolutely true. You don't want to have to send your patients someplace else to get those services. They may not even get to those services, so having a one-stop shop is critically important for the overall health of our residents. So again, I think it is important because I think that the city in this proposal, the amount of dollars to come to you to support our residents is $4.3 million, and you just stated that there certainly is a gap there, and that the cost actually to serve the 21,000 patients is about $7.9 million. So I'm thankful that you have this prescription program to be able to offset those costs. I will share that as I am leaving council, that is going to be imperative that you continue to share with my council colleagues and then the new council members the long-standing relationship between Primary One Health and the City of Columbus, and to share the information as you've done today. I think it is imperative that we continue to tell your story and why you are such an important asset to the city and to our residents. So I thank you for your presentation. And lastly, I'm very excited that I know have started a scholarship program at Primary One Health, and I think that that is so important because and I know this will be for again, we talked about workforce earlier, but it really is important that, and that when patients come to your institution or any institution, that they're able to see individuals who look like them providing care for them. And so I thank you for, you and your board for the vision to, again, ensure that individuals, one, get access to care in all different neighborhoods. But most importantly, that you have created this new program to ensure that individuals will be able to go to college, to be able to get the skill sets that they need to be able to provide those services, and that these are individuals that look like the people that are coming into your facilities. So I am appreciative of that work. And so with that, I will, again, before I conclude this hearing, I want to share that over the next several weeks, Council will continue to hold hearings on the Mayor's 2022 operating budget proposal, while I will conclude my service with City Council at the end of this month. Council will proceed as scheduled, and it is anticipated that the budget will be considered for passage in early next year. Before we conclude this afternoon's hearing, I want to thank the Health Commissioner, Dr. Mashika Roberts, and Anita Clark, the Assistant Health Commissioner from Columbus Public Health, Hannah Jones from the Department of Development, the Deputy Director, and I also want to thank from Primary One Health, Charlita Tavares, the Chief Executive Officer, from the Human Services Chamber of Franklin County, Michael Corey, Executive Director. I always want to thank my fellow council members and their staffs who serve our community with pride each and every day. The Legislative Research Office, Matt Erickson and Chris Maitland. My staff, Nicole Harper and Carl Williams. James Lewis and Mark Carter, as they coordinate the technology that allows us to hold these virtual and hybrid hearings. But most importantly, I want to thank the residents of the City of Columbus. And I want to thank them for allowing me to be able to serve in this capacity for almost 15 years. And this is my last hearing not my meeting is Monday, but hearing in council chambers. And it's really been an honor and a privilege to serve you. And so I want to thank you for joining us for the Health and Human Services 2022 Budget Committee hearing. And we are now adjourned. Thank you so much.